Hey, we're going to look at a really good friend of mine, Dr. Linda Stevens, who's a Gonstead chiropractor. She's amazing, a great friend of mine. Was my running partner for years, so we did races together. And anybody who knows her, like, she loves to be in shape, she loves to work out. So recently she's had a drop foot. So drop foot normally just means that when she does certain things, specifically running, she starts dragging her foot. Like, she may not drag her foot too much during the day, but then as the day goes on, the foot might drag, or when she's running. Now, she's had the electrical test, EMG nerve conduction study, which said that everything's fine, right? I was getting like shooting pains down my arm with some weakness, and I was shocked. I was shocked when I got an EMG test, nerve conduction test. This is probably like 4 years ago or 5 years ago. I was just shocked that it was normal. Like, in other words, like when you run and there's certain muscles that can't hold your foot up, you got to assume there's going to be some kind of nerve injury or whatever. But me and Dr. Stevens, we actually have conduction blocks. So that's why I wanted to make this video, because there's people that have weak muscles, or they have these nerve symptoms, and they do a nerve test and it's all normal, and it's like, how could it be normal? So injury to a nerve, that's degeneration. It means the nerve, instead of being this big, it's smaller. Like when you look at the nerve on MRI or on ultrasound, it's actually smaller. That's degeneration. It means nerve cells have died. Now, the cause of the nerve cell dying, if you get rid of it, right? If it's because you have ligamentous lumbar instability injuring your sciatic nerve, well, if you get rid of the instability by prolotherapy or by whatever means, the nerve should repair itself, or at least it should improve. Conduction block means that there's pressure on the nerve, not enough to injure the nerve. That's why the nerve conduction velocity and the EMG is normal, but it's blocking the electrical impulse from going wherever it should. So if this occurs in the vagus nerve to the heart, guess what? You get tachycardia. All of a sudden the heart rate starts increasing, you get palpitations. If it occurs in the vagus nerve to the stomach, guess what? You're eating and all of a sudden you're getting bloating and your stomach isn't working right. Well, imagine your perineal muscles, which elevate your foot. If all of a sudden Dr. Stevens is running, right? She's running, then the nerve impulses aren't going to those muscles. You get a drop foot, and that's exactly what's happening to her. Now, we're going to see here about Hauser's law number 2. So Hauser's laws were written to document how illness, diseases, conditions occur from a ligamentous or connective tissue etiology. So Hauser's law number 1 is, if there's a joint degeneration, it's going to be from ligamentous joint instability. Hauser's law number 2, which occurs here. So Hauser's law number 2 is that if you have a chronic disabling symptom, or you have a disease or a symptom that nobody knows the cause, if you follow the neurology will lead to ligamentous joint instability. So in other words, the perineal nerves, or the perineal nerve, is on the side of the lower leg, and I'll show you it. And then it innervates the perineal muscle. So the perineal nerve goes by the knee, it goes by the hip, and it basically forms with the tibial nerve, the sciatic nerve, which goes into the back. So you're looking at, does Dr. Stevens have ligamentous lumbar instability, sacroiliac instability, pelvic instability, hip instability, knee instability, and theoretically fibula ankle instability, because the perineal nerve goes by the fibula. The fibula is stabilized by the lateral knee and the lateral ankle. Okay, good. Okay, so basically that's her. We talked about that. So Hauser's law number 2. If you want to read about Hauser's law, There's an article entitled Hauser's Laws on the Ligamentous Structural Causes of Chronic Disabling Symptoms of Human Diseases. So Hauser's Law number 1, number 2, if the etiology of the symptoms isn't explained by these two, it's probably from ligamentous cervical instability or a fluid flow obstruction. On the right side here, you could just see it's just like she's drags it. You could just see there's something not right on the right side. There's just something not right on the right side. Normal vagus nerve conduction block means there's stretch or compression of a certain part of the perineal nerve, so the electrical impulse isn't getting to the perineal muscles, and it's occurring when she's doing something. So sometimes ligamentous joint instability is only manifested when you put pressure on the joint. So let's be honest, she's going to put more pressure on her hip joint, low back joint, knee joint, ankle joint with running, right, than standing or sleeping. Right, so we did this figure years and years ago. So if you look up perineal nerve problems, the joint instability it normally is the knee. So in Dr. Stevens, we did prolotherapy of the knee, and it helped somewhat, but it didn't resolve it. So I'll talk about that in a second. So the sciatic nerve, see how it runs near the hip, and then it comes from the lower back. The perineal nerve and the tibial nerve, they make up the sciatic nerve. Well, it turned out, even though Dr. Stevens had some lateral knee instability, the drop foot didn't get resolved when we stabilized the knee. So the next area we went to is the hip. And she's doing, since we've done the hip, she's doing a lot better. See the perineal nerve, it wraps around the fibular head of the knee. So usually foot drop is from lateral knee instability. In her case, we had to go further up, which it was hip joint. You can actually see the perineal nerve. You can do hydrodissection. So sometimes PRP or healing cells are injected around a nerve that's struggling. So Dr. Stevens had that. And sometimes there'll be numbness or tingling or something where the perineal nerve is with people with foot drop because the perineal nerve is getting irritated. And then you do prolotherapy in the area of instability. If it's the knee, you do the knee. If it's the hip, you do the hip. And then if you're somebody who the EMG of the nerve tests are normal, but you're convinced you have a nerve issue, by using Hauser's Law number 2, then follow the neurology and what joints does that nerve go by, and do you have clicking, popping, grinding? And Dr. Stevens had clicking, popping, grinding of her hip, and once we started stabilizing the hip, the foot drop, is just getting better.